Yes, thank you. It's a very long relationship. We started working here in 1989, and we came because everywhere there's a problem in reaching rural people with anything, and that includes healthcare. And this is all over Africa, actually all over many parts of the world. And so we were aware that people had often been donated vehicles, for example, motorcycles and even bigger and more expensive vehicles, but those vehicles were not reaching people and were not lasting for their natural economic and mechanical lives. So something was wrong with that. So we started to think, what could be wrong and how could that be put right? Because if people are waiting for care in rural communities and not getting it, that is an almost sinful situation where those of us can put that right and think about it, do not do so. This is an important moral question, not just a mechanical question. This is what are we like as human beings if we don't look after our fellow human beings properly? So Riders for Health, when we started working here, was based on that moral principle. It's not a for-profit undertaking. It's not for profit. Its sole purpose is the delivery of healthcare. We don't do the healthcare. We do the mechanical stuff that allows that to be delivered. And His Excellency the President is well aware of that, and he has talked to us on a number of occasions and encouraged his ministers to take this work seriously and to listen carefully when necessary to us, because we are the experts on this. If you try to run vehicles in a haphazard way, they will fail, and the consequences will be very serious. So it's an important undertaking, and it needs a close relationship with government. It needs an understanding and sympathetic relationship with government, and that's what His Excellency brings to this relationship and what he encourages other people in his government to do. So it's a very important meeting for us here today. Just one more thing I'd like to say. We don't think that our way of doing things is perfect. Like everything else in the world, it changes. And like most things in the world, it's systematic, and all systems need refreshing and changing and improving. And that's what AJ and I are here to look at on this particular occasion. We're looking at our systems, how they're working, how they should work better. And everybody's approaching that with care and humility. And what we are going to learn here about this approach to systems, which we've done for many years, but now we're doing that better, we'll be using in our other countries where Riders for Health now operates. As you know, it started here, but it has moved to other countries over the years. And those other countries should be very grateful to the Gambia for being the place where we started. So, and I think they are. So I think that's really what we're trying to say here, what we need to say.
I head the Riders for Health Africa country offices. As Barry said, we started from here. And the Gambia government is the first government in Africa to actually outsource its transport system for health to an organization. Two countries are currently asking us if they can come and see how it's being done here so they can replicate this system in their respective countries. We are very grateful to His Excellency President Barrow for having us and for maintaining and taking these services seriously for the Gambian people. Thank you very much.